Hola a todos. Hello, everyone. Just going to wait for another few seconds to give more people a chance to join. Yep. So we are reaching the 500 participants. Let's make a start. Hola a todos. Hello, everyone. My name is Vanessa Garcia Larson, and I'm the Chief of the Risk Factors and Nutrition Unit here at the Pan American Health Organization. On behalf of PAHO, I'd like to extend a warm welcome to you all and to thank you for joining us today during the World Obesity from our Director of the Department of Non-Communicable Diseases and Mental Health, Dr. Anselm Hennis. Ooh, I don't think I can hear that.
It is my pleasure to welcome you to this World Obesity Today webinar, where we have come together to discuss one of the most pressing public health challenges of our time, obesity. I want to extend my gratitude to all our distinguished speakers, including colleagues from WHO headquarters, UN Women, the World Obesity Federation, country representatives, civil society partners, youth advocates, and professionals from across the region of the Americas who are committed to advancing policies and actions to halt the rise of obesity. Obesity is a major public health crisis in the Americas. 67.5% of adults and 37.6% of children and adolescents aged 5 to 19 live with overweight and obesity. These numbers are indeed alarming, and they represent not just statistics, but millions of lives affected by chronic diseases such as diabetes, cardiovascular disease, and even some cancers. If we do not act decisively, preventable illnesses and premature deaths will continue to rise. But today, we're here not just to discuss the challenges, but rather the solutions. Over the past decade, the region of the Americas has led the world's progress in designing and adopting innovative policies to curb the obesity epidemic, including front-of-package warning labels, policies to promote healthy food environments in schools, fiscal measures, marketing restrictions, public food procurement regulations, as well as initiatives to promote physical activity and breastfeeding, among others. These are concrete and comprehensive steps in the right direction. And yet, we know that much more needs to be done with greater urgency and scale. That is why in today's webinar, it is so important for us to reflect on our progress, identify barriers, and determine how we can accelerate action. The PAHO Plan of Action for the Prevention of Obesity in Children and Adolescents established a solid foundation, with member states committing to evidence-based strategies. More recently, the WHO Acceleration Plan to Stop Obesity provided new breadth and reiterated commitment to speed up action towards the achievement of our billion healthier population target. PAHO remains committed to support countries in adopting, scaling up, and evaluating effective strategies to address obesity at its root causes, ensuring that all people, regardless of age, gender, or socioeconomic status, can access healthier food environments and opportunities for physical activity. But we cannot do this alone. Governments, beyond ministries of health, and to include ministries of education, finance, agriculture, transport, sports, gender, among others, must work alongside academia, civil society, and international organizations to transform the unhealthy environments that fuel this epidemic. Today's webinar is an opportunity to exchange experiences, highlight best practices, and reinforce our collective responsibility in turning policies into action. I encourage all of you to fully engage in today's discussion, share your insights, and most importantly, leave this session with a renewed commitment to taking bold action in your countries and communities. Let's work together to accelerate progress and build a healthier, fairer, and more equitable future for the Americans. Thank you so much.
Thank you. And just so you all know, we do have simultaneous translation available for English, Spanish, and Portuguese. So if you would like to listen to this webinar in a preferred language, please feel free to do so. So for today's session, our team has put together a really exciting 2-hour program where we hope to address several objectives. First of all, we are seeking to raise awareness to highlight the global and regional obesity crisis, its impact, and the urgency of multi-sectoral and intersectoral action. We are very lucky and grateful to have Johanna Ralston, the CEO of the World Obesity Federation, who is going to set the scene for this issue. We're also hoping to showcase solutions, and by these we hope to share success stories and effective strategies that can inspire and guide countries in developing their own approaches. And Luz Maria de Regil, the Director of the Nutrition and Food Safety Department within the World Health Organization, and also Fabio da Silva Gomez, our Regional Advisor on Nutrition and Physical Activity, are going to contribute with their perspectives and the evidence to support solutions at the regional level. We also hope, and this is extremely important to us all in the region, to foster collaboration. We hope to bring together government, civil society, academia, and international organizations to strengthen partnerships and promote coordinated action. We can't fight obesity alone or restrict obesity to a clinical condition. We very much hope that we can address obesity from a multidimensional perspective. We are going to have contributions from Cecilia Alemani, the Deputy UN Women Regional Director for the Americas and the Caribbean. We are going to also hear from Lilia Pedraza from the Alianza Global para la Alimentación Saludable de Niñas, Niños y Adolescentes, or ALSANA, and from Pierre Cook, the Technical Advisor for the Healthy Caribbean Coalition, who is going to share the huge potential of young people in the prevention and control of obesity. And finally, we are also hoping to promote accountability. We hope to encourage stakeholder engagement and discuss the monitoring of various types of frameworks, emphasizing accountability to address obesity as a public health priority. We're going to have the opportunity during this webinar to conduct a moderated discussion that is going to be led by our colleague Leo Nederveen, one of our regional advisors here at PAHO, where we look forward to hearing your insights and experiences. So thank you all again for joining us for what we hope is going to be a very fruitful session. And now I'd like to move on and welcome our next or first speaker, Johanna Ralston. There you are. Fantastic.
Yeah, thank you. Thank you very much, Vanessa. It's wonderful to be here. I'm Johanna Ralston, and I'm CEO of the World Obesity Federation. We are headquartered in London, and we have organizations that are members in over, I think, 110 countries now. Our membership has grown rapidly as the challenge has grown rapidly, as well as the recognition of the need for coordinated response. as you can see on the screen, our theme for World Obesity Day, which is today, is Changing Systems, Healthier Lives. So first of all, I want to extend a deep and sincere thank you to PAHO, to Anselm and Vanessa and all of our colleagues for inviting us to speak about this and to be another wonderful partner in celebrating and acknowledging World Obesity Day. Also, I want to just thank all the other speakers. I'm incredibly privileged to be here with you. And I wanted to note that while the title of my talk is The Obesity Crisis, I've made a little bit of an adjustment to say the Obesity Challenge, which is not because it's not a crisis, but because I think there's also something a little more positive, I think, as was just stated in terms of finding opportunities. And I think the crisis would be if we did not take everything that we know, all the policies that are in place, all the technical assistance packages, all the approaches, and consolidate and really, really ramp up action together. That would be a crisis. The challenge is working together, taking action, securing greater resources and more attention for this. Those are our challenges, and they're challenges that we all face. But I'm confident that I think working together and even in convening like this is very, very important and will help us get there. So I think, as we know, there was the WHO, well, member states adopted a target for 2025 back in 2012, 2013 on a zero increase in prevalence of diabetes and obesity to 2025 using 2010 baseline numbers. So zero increase in prevalence. That was sort of nudged out a bit to 2030. But I think for 2025, we can all agree that we have not seen zero increase in prevalence. In fact, as World Obesity Federation, a couple of years ago for World Obesity Day, we did some calculations of data and showed that projections where numbers would actually have prevalence would have actually doubled in that time. So that's not, that is speaking to a target that was very much missed, but I think also a lot that was misunderstood about obesity when the target was set. We very much know it is closely associated with how we live and eat and work and play. It is also, it's a more comprehensive and complex disease, and driver of other diseases is how we describe it. So if you would go to the next slide, I'd be happy to just walk through a presentation and look forward to hearing your comments on this as well. So is this something I'm meant to? Okay, good. I just want to make sure. So broadly, just addressing the obesity epidemic, what we need to do and why, progress, and what we need to achieve next. You'll happily see some old friends, I hope, in these photos showing the wonderful work that we're fortunate to do all over the world. Our current president, Simon Barquera, is, of course, from the region based in Mexico. We have Karen Seeley, our wonderful colleague from Trinidad and WHO, who is actually joining the World Obesity Federation board as a fantastic champion. And we've certainly had the highest levels with Dr. Tedros and others supporting our work as we work with WHO, UNICEF, and many other partners, including, of course, the PAHO region on addressing this. Next slide. Next. Yeah. I'm going to start with some numbers. That's the preview here. So hopefully we can get to the next slide. And sorry, I'm not in a position, I don't think. Okay, good. I think we know that there are most recently Lancet studies from 2022 under the new NCD risk data that were launched last year showed over 1 billion people with obesity. We're projecting that should be about 1.3 billion by 2030. The numbers continue to rise, and it will be doubling over the next decade or so. So this is all if we do not recognize that what we've been doing has been both, for the most part, just insufficient, that we need to be doing much more. We need to do much more together. We need to do much more in a coordinated fashion that works across sectors. So and another 1.6 billion with living with overweight, which is often a precursor to obesity. In today's obesity atlas, we also did a readiness index, which I'll tell you a little bit about later on in terms of how our country's actually doing to try to address this challenge. And then our friends at Lancet and Global Burden of Disease today launched new data around the childhood obesity projections, which are very much have become and will continue to be a challenge particularly in low and middle income countries. So here's again initial numbers. The costs, as you can see, and next slide, please, I'll just describe this. The costs, we're anticipating around 3 trillion per year over the next decade. We did some economic data analysis as a way to try to show another way that the burden of obesity is rising and needs to be addressed, and showed that with business as usual, with inaction, which means mainly means people dying prematurely from cardiovascular disease, diabetes, and cancers that are attributable to obesity, as well as lost productivity and other related costs, was broadly speaking around 2% of GDP for 2020, and would double between then and in another sort of 30 or so years. So obesity is already causing is both causing social costs and enormous amounts of stigma and untreated disease, and it's also contributing to economic sort of inequities and diversions of resources. So the rise in number of individuals living with obesity from 2005 to 2035 is continuing to climb, as I mentioned. So we'll be almost at double the 2022 numbers by 2035, which is less than 10 years away now, right? Next slide. And one more piece of just data. Again, 400 million children living with obesity, not just overweight, but obesity by 2035, really 1 in 5 children. I think most strikingly as well, we'll be seeing sort of more than around that time, sort of more than half the world's population living with overweight and obesity. So it is something that is everywhere in every single country in the world. Next slide. I think this is a really important piece of information as well. So this is numbers that we're projecting for 2035, and you'll see 2 countries from the PAHO region in here. This is really in terms of sheer numbers, so it's very much rooted in a country's population. But there has been a myth that obesity is a problem or a challenge of high-income countries and high-income countries only. There's also been a myth that it's all the matter of sort of personal responsibility and indeed personal blame. If we look at these numbers, we can see the United States is a high-income country, and I think the only one in this list. The rest are generally middle-income countries, including, of course, Brazil and Mexico, where rates are exceptionally high and numbers of people living with obesity are high. So this speaks to this has transitioned. It has fully transitioned to being a global challenge. And the issues that are driving obesity or that will need to be addressed to resolve obesity in a place like Nigeria are, of course, going to differ from what they might be in Pakistan or India or the US or Brazil. So there is much we need to do and learn, although there's much we already know that can be effective and we know can help provide some relief in terms of climbing rates. Next slide. Yeah, 90% in LMICs. One of the challenges we say, this is a completely unofficial statement, but this diagram I think could be helpful, is obesity is everywhere and nowhere. So it's a matter of being something of a political priority, but not enough of a political priority. It seems to sometimes be 3rd or 4th or 7th or 8th on the priority list of health topics. We saw the Lancet study on sort of the 2050 investing in health. It wasn't really there. It was like, how could you possibly talk about 15 priorities and not list obesity there? It was listed in some general terms, but nowhere near sufficient in terms of commensurate with its burden and commensurate with what we know we can do about it. But this diagram, I think, is also another helpful way of illustrating. This is something that we developed 5 years ago for World Obesity Day, and that continues to be a useful way of explaining why is it that eating less and moving more hasn't worked yet or is insufficient. Well, on the one hand, we've not done enough and had enough resources and investment or ability to overcome industry and interference in terms of policies around eating, addressing food and physical activity, but also we've not understood the complexity of the drivers and tailored approaches to treat that. And this is a complexity that many other non-communicable diseases and problems, complex problems face, which is that there's more than one driver, and you need to be working at multiple levels. So whether the driver is marketing, as it very much can be in many parts of the world, including in, for example, Mexico, the Pajaro region, the Caribbean, stigma and sleep. There's also a genetic factor. There is lack of access to healthcare or lack of inclusion of and measuring of obesity in health systems. That means that the burden is poorly understood and not addressed until the individual presents with a comorbidity, if they ever do present in the healthcare system. Biology is certainly a factor. Of course, food, unhealthy diets, ultra-processed foods are all playing a role in this. And life events, all of these different elements can contribute to this. And again, 70% of cases of obesity have a genetic component. Next slide. So that's just to set up the political challenge. Why is it? Why are we here? Well, here's some things. If you can do that, that's great. So as we look at the SDG targets, and particularly the 2030 targets, we desperately need to address obesity as a global health crisis. And again, that's why I'm here, what I'm saying. So our current atlas shows that 2/3 of countries worldwide have none or just one of the 5 key policies in place to address obesity. These policies range from policies around policies and surveillance around food and unhealthy diets and around physical inactivity, but also around measurement of obesity. Is it included in surveys? Is it part of the health system? Is there any reference to it within primary care? 7% of countries only have health systems adequately prepared. At World Obesity Federation, we're relaunching the MAPS2 program, which is to do updated mapping of where obesity sits in health and food systems in different countries, so that we can better understand and support countries in tailoring their challenges, understanding that there is not a one-size-fits-all approach, but there is a comprehensive set of approaches that can help any country to address obesity. A very quite high number of premature deaths from NCDs are associated with obesity, meaning that we hear talk of not reaching the NCD targets to 2030, and the UN high-level meeting later this year will address that. But we have so many deaths that are premature deaths that are actually associated with underlying obesity that had contributed to the cardiovascular disease, to the diabetes, et cetera. So until we really have a robust, ambitious, and coherent strategy, we are going to still face not just the challenges of obesity itself, but all the other diseases that it's driving. So these are, again, just some of the key elements, and I do recommend using the Global Obesity Observatory at our website. You can find data for every country, not just on disease burden and rates, but also on economic impact. Next slide, please. I'll be winding up in a moment, in 2 minutes. For our current 2025 to 2027 work plan, we've decided to orient ourselves around the fact that we cannot reduce by 1/3 premature mortality from NCDs without much more ambitiously addressing obesity, and that universal health coverage is a critical package. We're also very supportive of the WHO acceleration plan as a wonderful tool, which has as its aim halting the rise in obesity among children and adults, as well as ending all forms of malnutrition. Next slide. World Obesity Day has become a powerful, and we're really, we like to think, co-owned tool to address this. And we've been able to communicate some priority key messages over the course of the 5 years that we've been doing World Obesity Day on March 4th. And it has really helped us to help support WHO in achieving the acceleration plan and obesity recommendations. We look forward to ways that each of you leverage your World Obesity Day experience to launch key reports, to have key activities and key messages. Next slide. Within the WHO Acceleration Plan, we are very supportive of we worked closely on the WHO recommendations that were approved in 2022, which are, again, comprehensive. They include all the different elements that are needed to effectively address obesity that can be tailored to the specific needs of a country, and work towards supporting the front-runner countries, and indeed all countries, in their own global action plans. We help with bringing our civil society members, representing everything from the professionals to the frontline advocacy leaders, to have a coordinated plan around this and to take action. Next slide. We are excited for World Obesity Day. We will be in Brazil. Our friends have again had the illuminating monuments to address the day. And we look forward to seeing all of your photographs. We have some wonderful pictures already coming in. It's been a fantastic World Obesity Day this year. Next slide. So with that, I just want to say thank you. So hopefully I've been able to give you a sense of the crisis, but also the opportunities we have to work together. And please do not hesitate to contact me at World Obesity Federation with any questions, ideas, suggestions you might have. This is our wonderful team in London. We were recently celebrating the Lunar New Year, and every day is a day to celebrate when we can all work together on such important work. Thank you.
Thank you. Thank you so much, Johanna, for that really inspirational presentation. And it really is very nice to see the magnitude of the problem, but also the opportunities that we have to address it. And I hope that during the discussion we can hear from our participants and learn about the experiences that everyone is having in their own countries. So thank you so much again. We're going to move on to our next guest speaker, and I'm delighted to introduce you again to Luz Maria de Regil, the Director of the Nutrition and Food Safety Department at the WHO, and she's going to present the WHO Acceleration Plan and the technical package to stop obesity. Over to you, Luz Maria.
Muchas gracias por la invitación.
Thank you so much for the invitation. I will be giving my presentation in Spanish just to avoid any hiccups. I've tried to for all my presentation in Spanish, but you'll see some slides still in English. This is the technical package that's part of the WHO Acceleration Plan to stop obesity. Could you please confirm if you can hear me and listen and see my presentation? Next slide, please.
La obesidad, Johanna dijo claramente por qué nos
Johanna
tenemos
said
que
it clearly.
Creo que
She explained
esta es
very
una de las
well
condiciones
why
que no
obesity is a
necesita
point of
mucha
concern,
explicación.
and I don't think a lot of
Es una
explanation is
preocupación que
needed here.
normalmente
This is
es a nivel
a
individual.
concern
Alguien
that
se
normally
preocupa si tiene
takes place
exceso de peso o
individually,
no, la
right?
familia se
Normally,
puede
people are
preocupar,
concerned if
pero los que
someone's
trabajamos en salud
overweight,
pública
but those of
vemos
us working in
con
public
alarma
health
que va creciendo
see an
en
alarming
magnitud
rise
a lo largo del
in
mundo.
magnitude across the globe.
Prácticamente todos los países han mostrado una
Virtually
tendencia
all
creciente,
countries have
sobre
shown
todo cuando no tienen
a
políticas
rise,
para
especially when there
controlarla.
are no policies in place to
Y
control obesity.
realmente ahora está a lo largo de todas las edades. Lo vemos
And
desde niños
this is now
pequeños
present across
y
all
lo vemos
ages. We
con
see it
problemas
in
asociados
young
de salud
children,
desde
and we
edades
also
muy
see
tempranas.
health-related
Como
problems
dice
coming
esta
up at
diapositiva,
very young ages. As you can
más
see
de
on this
1.100
slide,
millones de personas
over
tienen obesidad
1.1
y,
billion
y
people
alrededor de una
have
décima parte
obesity,
son niños y adolescentes.
and
Se
about
espera que para
10% of
2050
them are
sean alrededor de
children.
2.300
For
millones de
by
personas.
2050, the
A la tasa
expectation
que
is that
vamos
this will
puede ser
be
incluso mayor
2.3
a la velocidad
billion
que
people,
vamos.
even higher,
Y
though, at the rate we're going.
también se sabe que la
We
obesidad
also
es un
know
factor importante, un
that
predictor
obesity
importante de otras
is a
enfermedades
major
no
factor in
transmisibles
terms of
e
other
incrementan la
NCDs,
mortalidad en
and
el
they
año.
increase
Un
mortality
artículo publicado recientemente
year
hoy,
by
de hecho,
year.
habla
In
de que
an
tenemos
article
estos
published
5
recently
años como una
today,
ventana
we
crítica
have
para
a
revertir
5-year
las
window, a
tendencias
very critical window to see what
que se
happens
esperan
with
hacia
these trends
2050.
and
Los
what
costos a los sistemas de
happens
salud
by
son altísimos.
2050. When we talk
Alrededor de, en
about
español,
healthcare
3
costs, these
billones,
are
en inglés 3
astronomical.
trillones.
It's
De
3 trillion
costos al servicio de salud y van incrementando.
$3
Este es el
trillion
costo que la
per
obesidad
year by
tiene.
2030.
Y por
That's the
supuesto,
expectation in terms of
como
global
decía,
costs.
tiene
And
alta
as I
incidencia
said
en otras
earlier,
enfermedades y altos costos
this
relacionados
has
a
a tremendous
al
impact in
tratamiento
other
de
diseases and in other treatments as well.
comorbilidades asociadas. La siguiente diapositiva, por favor.
Next slide, please.
En 2022, los
In
países,
2022,
la OMS propuso como
the
respuesta a lo que
WHO
pidieron los países.
proposed, in
La
response
diapositiva dice,
to what the
el plan de
countries
aceleración está
requested,
liderado por los
an
Estados miembros.
acceleration plan that would be led by the
Los
country
países
members.
miembros de la OMS le pidieron al secretariado
the
proponer
countries
algo, un plan
requested the
para
Secretariat
empezar
for
a
a
prevenir de
plan,
manera
some sort of
sistemática,
proposal
prevenir
that
y
would be
controlar la obesidad.
implemented systematically in order to
Como les
prevent
decía,
and control
justamente porque
obesity.
la obesidad en adolescentes y en adultos
Because, as
muestra
I
una
said,
tendencia
obesity
creciente.
in teenagers and
En
adults is on
2022
the
se
rise,
propuso
according to the
el plan de
trends.
aceleración
In
para
2022,
detener la
there was a
obesidad.
proposal
A
for
día de
the
hoy ha recibido una
acceleration plan to
respuesta muy
stop
importante de
obesity.
los países
So far, it has
y
received some very
34
positive
países
response
son
by
los
the country.
líderes que
34
se han unido a este
countries
plan.
are
¿Y qué quiere decir
leaders
unirse a este
in this
plan?
plan. What does it
Firmar al
mean to
nivel más
join a
alto del
plan as a leader?
compromiso, decir,
To
yo quiero ser
adhere
parte de
to the
este plan
highest form of
y
commitment,
quiero
meaning I
implementar
do want to be part
políticas
of this plan and I
que
want to
van a
implement
ayudar a
relevant
prevenirlo
policies
y
that
estoy
will help
comprometido a
prevent
implementarlas, a
obesity, and I'm
monitorizarlas y a
committed to
reportar a
implement
nivel
them,
global. Y eso es algo
monitoring
importante
them,
porque ese es el compromiso, no
and
nada más
doing
decir
this
sí, sí
globally.
estamos
And
haciendo algo,
that's
pero
the
realmente
real
tratar de
commitment. It's
hacerlo
not about
y
saying something that you
pedir la
want to
ayuda,
adhere
recibirla y
to
compartir la
them,
experiencia para
but it's
hacerlo.
also
En
about
este
asking for
momento hay
help,
34
receiving that
países,
help,
como les
and being willing
mencionaba,
to
que son
share it.
parte
As
del
I
plan de
said,
aceleración
34 countries
y
have
que
been
cubren
officially part of
1
this
billón de personas, un
acceleration
poco
plan,
más
and this covers
de 1 billón de
1.3
personas, un
billion
millardo de
people.
personas en español, y un tercio de la población que padece
And one
obesidad.
third of the
Entonces,
population
encontramos que
in
no
this
solo es el
group
número, sino la
has
concentración de
obesity.
casos de
So
obesidad
it's
que es
not only
importante. Hay
relevant in terms of the number, but
parte de
also in terms
abajo
of the
está la lista de
proportion
países que en este
that's
momento
covered here.
tenemos.
And in blue, you can see the
Afortunadamente
countries that have adhered.
estamos recibiendo más
Fortunately,
expresiones de interés
we keep
y bueno,
receiving
estamos trabajando
expressions of
para
interest,
que más países
and
se
we
unan.
are working so
La
that
siguiente,
more
por favor.
countries can join. Next slide, please.
Desde que empezó este plan de aceleración,
Since this
lo que ha pasado
acceleration
es que ha
plan
habido
started,
como les decía, un gran compromiso de los países
there has been
y
tremendous
como
commitment
resultado de
by the
esto se
countries.
empezó a poner un
As a
paquete
result,
técnico
we started
que pudiera,
using
como
a
parte
technical
de
package
políticas basadas en evidencia que pudiera
that
ayudar en
is
este
based
interés
on
de manejar y controlar la obesidad, de
policies
prevenir y controlar la obesidad.
in order to prevent and control obesity.
Lo que pasó es que ya
What
la OMS
happened
tenía muchas
was
políticas
that
en el área de
WHO already had a lot of
ambientes
policies
alimentarios
in terms
y
of
por otro lado había cierta
food
experiencia
and
en el
nutrition.
fortalecimiento de
And
los
there
sistemas
was
de
some
salud para
experience
dar
in how to
mejores
strengthen
servicios,
healthcare systems
y
to
por otro
offer
lado había
better
trabajo
services.
en
Additionally,
determinantes comerciales
there was work
acerca de la obesidad
done
y por
in
otro
terms
lado
of
había
commercial determinants
trabajo en
related
el
to
área de
obesity.
behavioral
And there
insights.
was
Lo
also
que se ha
work
hecho con
being
este
done in
paquete es
behavioral
traer
insights. So what we
todas
did with
estas
this package
intervenciones
was to bring
enfocadas en un
all
lado
those
en particular,
interventions
en un resultado
together,
particular como es la
focused
obesidad,
on a
ponerlas en
particular
retratar
target,
y además
obesity in this
predecir el
case,
beneficio
and
conjunto
try
que
to
tienen
predict the
estas
joint
intervenciones.
outcome of all these
Sabemos que
interventions.
algunos países implementan una
We
política
know
u otra,
that
pero el
some
objetivo es
countries may
tener
implement
varias
one
políticas que como
policy or
paquete
another, but the
puedan
goal is to have a set of
ayudar
policies
a
that, as a
controlar la obesidad
whole,
de una
can
manera
help control
a
obesity
través de los distintos puntos de entrada.
by means of all the different
Eh,
entry points.
el principio de este paquete, como les decía,
The
tiene
principle behind this package
muchas intervenciones, pero se
is
tienen que
has
establecer
a lot
metas
of
y objetivos,
interventions, but
se
it does
tiene que
it is meant to
priorizar
establish goals
intervenciones que
and
ya tenemos,
outcomes.
para
The
las
idea is
cuales
to
tenemos experiencia y en
prioritize
muchos casos
interventions.
otros
In fact, we have
paquetes
some
técnicos que
experience in
que
this,
ayudan a implementarlas
and
y
there
les
are
ayudan.
other technical packages that help implement this,
Herramientas para implementarlas y también se
meaning
traen distintos
tools to
actores, no
implement this.
solamente
And
es el
we
área del
also
personal de
engage
salud, pero por
different
ejemplo, si estamos
stakeholders. It's not
hablando de
only
la prevención de
healthcare professionals,
mercadotecnia
but
o de
also
control de
marketing
mercadotecnia, se tienen que
experts.
traer otros sectores
Because
como
if we talk about
comunicación para
marketing,
compartir
we need to
experiencia.
get other
Evidentemente,
sectors involved,
la
such as
sociedad civil
communication.
tiene un papel muy
And so in
importante en
this sense,
compartir estas
civil society
experiencias de la
does have a
abogacía y es
definitely
tratar de traer
important
a muchos
place
actores
to
para que
occupy.
puedan de
So
manera
it's about bringing
conjunta
together a
co-crear
very group of
soluciones y
stakeholders so
ayudar a
that
los
they can
gobiernos a
together
crear soluciones
co-create
que sean
solutions and
mucho más
help
factibles para
governments
los
come up with
países.
solutions that are
Una
relevant
parte
to the
importante
countries.
del paquete
An
técnico
important part of
que es
this
parte del
technical
plan de aceleración
package that
es que
is
se
part of
centra
the acceleration
en la
plan
ejecución
is
y en
that it
acelerar el
focuses
impacto en
on
los
the
países.
execution and
Y como
accelerating
les
impact
decía,
on
tiene un
countries.
sólido
As I
mecanismo de
said,
rendición de cuentas.
there's a
La siguiente,
solid
por favor.
accountability mechanism behind. Next slide, please.
Este paquete tiene
This
15
package
intervenciones que en el inglés
covers
tienen
15 interventions.
acrónimo ACT, que
In
es
English, they
adaptarlos
are grouped under the
de
acronym
ambientes
ACT.
para que
And
haya
so
estilos saludables,
they
más
have to do
saludables,
with adapt
crear
environments to enable healthy
conocimiento
lifestyle,
y motivación,
create knowledge, motivation,
educate,
and skills for
transformar
healthy behavior,
los
and then
sistemas de salud para
transform the health
responder a
systems
esta
to to respond to the obesity pandemic. Well, some people talk about obesity pandemic, others talk about obesity crisis. Some will use neither. They will just say it's a prevalence disease, but we do know it's a condition that requires immediate action and attention in the healthcare system. Next slide, please. As for the methodology used in this package, in a little while I'll share the interventions. This has to do with prioritizing. Of course, there are principles based on equity, on universal health care, on putting the focus on people, in integrating the community. This is also based on the principles of universal health coverage, which has a lot to do with primary care and equity. And this is important because there are so many interventions in so many different areas. We need to take into consideration that the health sector is a priority, but it is not only restricted to the government, it's also part of the communities and the societies if we want outcomes to be there. So we prioritize, and there's a set of principles. Then the analysis stage comes in. This package actually started out with a small field test, and some countries have already received their training. We are now working on tailoring this to each country, and we are now in the pre-release stage. Soon you will see all these images in the WHO document. Next slide, please. This slide is very loaded, but I just wanted to show you some idea of the interventions in ACT. As you can see here, there are interventions to improve environments and turn them into healthy environments. It has to do with food environments, for instance, in schools or in common areas or in different environments. There are also interventions focused specifically in school systems, because we know there's increasing interest in monitoring school systems and providing better food there to stop obesity. This also involves physical education, physical activity, supporting campaigns, and a very important element, even though it may look small, is that the healthcare system needs to be ready to prevent and treat obesity. We know that there are pharmacological interventions at the time that are being made available across the globe, but we also know that in many areas, the staff is not entirely trained to manage and prevent obesity. So it's important to review what are the processes in healthcare system, and this covers from the workforce to healthcare services and all the other interventions. Next slide, please.
Una parte importante es que no es solo una intervención, es un paquete de intervenciones.
Tal vez no sean las 15 intervenciones las que son relevantes para cada país, sino son many are important. Pero debe haber una priorización basada en la factibilidad. There needs to be some sort of prioritization based on feasibility. This technical package follows the cycles in the policies to implement them. So it covers implementation, follow-up, evaluation, and design. Many of these are part of the regulatory framework, and some of these are part of the direct interventions. Some of this may also involve medication, etc. It's important to notice that policies are still relevant and efficient. And it's important to maintain that these are science-based. And that way we can truly offer consistent solutions to this problem. Next slide, please.
And as I said, this package has been tried in several countries, and I wanted to give you a sample of how we prioritized in the 44 countries that are already members. Practically out of those 44 countries, not all of those have prioritized these policies, but at least 15 countries put as the intervention as a priority to improve the chronic management practices for the prevention and treatment. So we are working with them in the health systems area for them to help us for the integration of this in the management of obesity. Very importantly, we have seen that countries want to regularize the marketing of non-healthy products. They want to have an active practice. They're also exploring the implementation of taxes for sugary sodas and to expand taxes of these products, for example, juices and other foods. We are prioritizing at this moment the sodas and to expand these policies. These countries have the school system. They put nutritional facts in their labels. This really improves the selection of foods for children and adolescents, and this helps also with prevention. So, as I said, the combination of several of these countries, most of them have more than 2 or 3 interventions, 4 interventions in a very narrow scope of time. And in the next slide, I show you that when these countries use these packages, behind each intervention, there's technical support, tools and implementation. So countries normally go to the first part in this international dialogue. They establish their goals. I want to join the acceleration program, and then they go to the following phase, to the national dialogue for the application. Then they go to the third phase, which is to execute the interventions. After setting the priorities, they start to execute these priorities, and this is known as the 100 days plan. They go to the different places so that we conduct regional workshops, and we try these to be workshops combining different regions. For example, in the region of the Americas, they've been the leader in the food policies, and this is the experience of tagging or labeling food was the key so that other countries in other regions could learn. Fabio was a champion in this region, in this sense, conducting this job among different regions. And so we start with this phase, and the final stage, which is phase 4, is to start in this acceleration program with the workshop, 100 days. They go to the focused attention so that they can start to implement their policies, and then they go to a sustained technical support so that they can continue. We know that implementing policies in intervention is not just 100 days, it's a year, it takes time. But I can show you here that this is an indication several countries are entering the phase 3, and they have different interventions for breastfeeding, taxes, tax. So we have a combination of countries which are in different stages. They are establishing practice communities where they can share the information, and generating information at the same time will improve the technical package in the following years. And with this, I'll stop because I have already gone through my time. So if you want to contact us here, you have my email address. or else you can contact the technical leader, Francesca Celletti, who's behind this acceleration program. And of course, I just wanted to reiterate that Dr. Tedros has a great commitment and he gives us great support to prevent this and to advance in these efforts to prevent obesity and control it. Okay, now back to you, Vanessa. Thank you very much for the opportunity. Thank you very much, Luz Maria, for sharing this perspective of the efforts that WHO is doing worldwide to stop the advancement of obesity. So I also hope that in our discussion, we might have further opportunities to exchange. Now we go with our next speaker, Cecilia Alemán, the Deputy Regional Director for the Americas and the Caribbean with the UN Women. She will share with us a presentation about gender perspective in obesity. Thank you very much, Cecilia. And please, the floor is yours. Good morning, everyone. Thank you very much, Vanessa, and of course, all the colleagues of the WHO and PAHO. Thank you for inviting us in this important day, and also because I have the honor of sharing the launch of this technical package for the acceleration plan to stop obesity. And I'll start by connecting with some of the questions that we have been receiving in the chat. I would like before that to say that we had advanced in parallel jointly with the WHO and the PAHO in the region in a framework to face the other pandemic, which is the gender violence against women, children, within this framework of respect, and that we have been working with several governments and the region with the cooperation of the World Bank as well. In a way, this reflects this systemic approach that nowadays represents the fight against obesity, and that we do hope to advance into this third stage in the region, as we have seen that you were showing. We are convinced that this kind of a focus that follows the good practices and how to continue with our efforts in a systemic perspective can help us to revert these indicators, which are preoccupying the projections and the regional data. And today, in this World Obesity Day, I would like to raise two aspects. First, I would like to summarize what we have just heard because of the poverty, the lack of time, a gender perspective, Latin America and Caribbean. And secondly, I would like to go back to certain policies, recommendations, and efforts to continue boosting into the region with this focus with UN Women, of course, and to accompany with the leadership of the PAHO in this. We heard Johanna Ralston. At the regional level, we need to be more ambitious with Latin America and the Caribbean. We need to continue with the Sustainable Development Goals, and this is connected to malnutrition and food safety, and this is so preoccupying with obesity. So the trends in the region, in spite of the fact that we have been doing all these efforts, they still don't show a reversion in the Sustainable Development Framework. But of course, we have this window, as you were saying, a 5-year window where we expect that this focus might help us to correct this with the help of the societies and the political will of the decision makers and the policymakers. From a gender perspective, malnutrition in all its ways includes also the retardation in children growth, the lack of micronutrients, obesity, and overweight. Of course, this is a preoccupation to us, and this constant increase that we have seen at the global level in the last decades also happens in the region. The prevalence doubles the worldwide estimates in Latin America and the Caribbean. It reaches almost 30% of the adult population in the region until 2022. This implies that, of course, there's a red flag for the region. We need to connect, as you were showing, the different public policies. And of course, the gender gap in Latin America has to do with food and safety, and it could be aggravated not because of a lack of political will, because many countries want to advance, but for the increase of extreme climate issues and natural disasters. We are one of the regions that faces most of these situations that in a way affect the whole system of production and the food system, many times in a sudden way with no possibility of immediate reconstruction. So many times in our reconstruction tasks, rebuilding the healthy food system is not amongst the first priorities of the ones who designed the rebuilding after natural disasters. And this is something that we need to raise awareness on and contribute to transform. And of course, as we heard, men and women are affected differently because all the chronic diseases and non-communicable diseases and the multiplying effect of obesity has already been clear in this sense. Besides, when we talk about death due to the non-communicable diseases, we are referring to evitable deaths. So this is another red flag. And this is combined, all these factors are combined, the cultural, social factors are combined, and this intersection between poverty and the difficulty to leave this trend in the region. In 20 countries in the region, obesity in women is at least 10 percentile points higher than in men. Of course, there are countries with higher gaps, Jamaica 18th, and we have also data for the Caribbean. It's not always of the last years. Here we have a challenge with the data, which is critical in order to conduct public policies as well, based in the empirical evidence. But yes, we do have reports in the region with the PAHO and other systems of the UN. They could prove how women in these urban regions, and specifically the ones that could only have primary school, have a greater prevalence of obesity than those that are at rural areas. So there are specific cuts, desegregation, access to education, and we also see monetary income and poverty over time. Poverty in the region affects women, and if we see the data of the latest years, in 2023 there were 121 women in poverty and 120 in extreme poverty out of 100 men. This allows us to see that we have a clear incidence of poverty that is greater in women. And this feminization of poverty, not only have we not reverted it, but it is greater when we talk about women that face multiple discrimination, indigenous, Afro-descendants, women in vulnerable conditions. So, besides, women dedicate further time of their lives to care, activities of care and unpaid care. Cooking is part of this, and this has to do with all the care related to the sustainability of life, including food, but hygiene, cleaning, do the grocery shopping, taking care of the people that are sick at home, and helping newborns or the elderly or the handicapped. The data that we always share is that women dedicate three times more to care activities than men in the region. But if we go to the poor, this is way much higher. And of course, this strengthens their difficulty to have their own income and, of course, to decide, and this is part of the challenge that we have, to cost more, to afford more, to afford healthier regimes, because one of the barriers towards a healthier food has to do with the cost. That's why we were talking about the reduction of taxes and, of course, the time. If the poor families that are monoparental and women have no one else to share these activities with, and they have lack of income and time, there we have a knot to reduce obesity, particularly not only in the poorest homes, but those ones that are in the border of the working class, that they could fall into the poverty line. Nowadays, the data shows that 40% of women in the first poorest area devote themselves to work at home, taking care of their children. So they have no income, compared to 15% of women, which are in the fifth area, the ones that have better income in our society. 40% dedicating only to their home, so they have no income, compared to 15%. So there's a very strong cut that we need to work in the fiscal and progressive policies that should be different for these homes. They should not be the same, but we know that we have fiscal policies that are linear, related to taxes and labeling. We need to work into the progressiveness of fiscal policies as well. And going back to public policies, I wanted to share that the relationship between unpaid work and the lack of income is clear, and this is connected with the increase of the risks, even more in those monoparental homes, so that their children and adolescents could have lesser risks of obesity and malnutrition. This poverty of time, connected to the poverty of income, is connected with the territorial segregation. So everything that has to do with the development of urban plans and territorial organization plans should not be disconnected from this reflection. Recent studies published in September by the University of Harvard said that living in places that are far from markets in the first years of life is connected to 50% risk of obesity. So this systemic dimension that the WHO shows of making this is confirmed because of all the evidence, not only the ones that come from health and that really had to be considered. Definitely, what we need to take into consideration is that the public policies do not take these responsibilities to the impact that this has in the time that women dedicate to their homes, because unfortunately they are the ones who dedicate the most time to care activities. We need to redistribute this, because they continue to be the responsibles for their dependents. Not only do they face all this poverty, lack of time and lack of income challenges, but when they have a paid job, it is informal, so they don't have access to social security throughout their lives. And they are the ones that have the greater risks of facing horrible costs of health at their homes when they are the ones who are sick. There are studies that show how they continue to care for their family instead of going to the doctor. So they need to be integrated into the public health system. But we see these conditions when we think about this betterment of the public policies. And of course, and with this I finish, with these public policies, the first has to do with what we have already heard about: continue to insist on data and the need of having public collecting of data, behavioral aspects and metabolic aspects, and also the determinants to the position of risk in taking into account gender, age, and race, as it happens in several countries. And we also need to ensure that these new public policies don't carry the responsibility exclusively on the ones who care, because they overwhelm them, and they are mostly women and their burden is enormous. We have seen other policies, the policies of climate change mitigation, and they are also giving their responsibilities to women, overwhelming them. So here is a red flag that we need to think about this in these reforms. And in these efforts, taking into account consumption and production, which are sustainable, of course, there's a dimension that we saw in the previous slides of sensitive of raising awareness on the society, but it has to be hand in hand with the promotion of healthy food and the access to incentives to production and fiscal incentives, not only from the criminalization perspective of what is not healthy, but also to the access, so that the ones who produce and sell sustainable foods and healthy foods should have a tax reward. This is part of the equation that is hand in hand with the other one, because there's an agenda that's very effective, but not only has to go with the other dimension, and how to make that there's not only a cost that's paid over the ones who make the consumption. And I want to raise a point on fiscal policies on food and beverages.
There's been great progress in terms of labeling, placing food on the shelf, but it's very important to also argue not only expanding these notions in the reform, but also the use of those fiscal or tax related revenues and using them, yes, for health purposes, but also for programs of prevention and care. Because if those programs are not strengthened with public policies, this is what happens. There's a lot of work that goes to waste. And another important question is to how to integrate this into sustainable purchases. And that's the end of my presentation. Thank you, Cecilia. This is what we were looking forward to with your intervention, to traverse all the different dimensions associated to obesity, social dimensions, family, climate change, the specific situations that both men and women have to face in different scenarios. So thank you very much for sharing that perspective with us. We will now move on to our next speaker,
Silva Gomez, our regional advisor for nutrition and physical activity, who's going to outline the WHO action plans for the prevention and control of obesity in the Americas. Thank you, Fabio. Over to you.
Muchas gracias, Vanessa. Bueno, primero solo
Thank you
recordar a
very
todos
much.
que hay una, porque vi
I
que
would
algunas
like to
personas
remind
tienen
everyone
dificultad con el audio. Hay un
that
icono que es un
there's an
globito, ahí pueden
icon
elegir
on the
su
bottom
idioma
of the
solo para
screen
recordar.
by means
Y
of which you can
también, bueno,
choose the language
agradecer
of this
a la
session.
presencia de todos.
I
Vemos
would
y
also
todas, ya
like to
vemos que
thank everyone for
alcanzamos
attending.
500
I see
participantes.
there are
Entonces, si
500
ustedes tienen
attendees
algún
here.
colega que no ha logrado ingresar, es porque
If
alcanzamos el
some of your
límite de
colleagues
500
could not
personas
manage
en
to join the
en
session, it's
este
because we've reached
webinario.
the
Pero vamos a
capacity
tener la
limit for this
grabación y ustedes
webinar. But
podrán
the
compartir
recording will be made
con
available
todos los
shortly,
quien
and that will
les
be
gustaría
shared
estar y no han
with
podido
anyone you want, those
encontrar
of
un
you
espacio
who
dentro de
couldn't
esos
make it
500
here
con los
today.
que sí estamos ahora. Voy a intentar ser muy breve porque
I
estamos
will
con
be
recuperar un
brief
poco del tiempo.
because we're on a
Me
time
gustaría un
limit.
poco empezar haciendo una un análisis de
I
cómo
would like to
hemos
start
avanzado en
by
nuestra región
sharing some
y
insights of the progress
indicando
we've
cómo en
made in
nuestra
our
región de
region,
las Américas ya
indicating
teníamos un
how
plan, este
in
plan
the
que fue aprobado
Americas
en
there's been this
2014
plan which was
de manera
approved in
unánime por todos los
2014
Estados miembros
by
de la
a
OPS y
unanimous
está muy
decision
alineado
from all
con el
the
Plan Mundial
PAHO
que la
state
Asamblea
members, and
Mundial de
it's very
Salud
much in line with
adopta en
the world
2022.
plan
Eso significa
that the
que
WHO
eso ha un
adopted
poco
in
apoyado que los
that was
países
adopted
puedan
in the
seguir
assembly.
de manera alineada y seguir
And
con
so
esfuerzos que ya
this has
venían. Eso
allowed
un
us
poco
to
explica lo que
continue in
mencionaba
the same
Luz,
direction
¿no?
of
De este
efforts that
liderazgo de
started
la
out
región,
before.
el hecho de que ya teníamos un plan
And this
anterior y
sheds
que este plan
light on
viene
how
bien
on the
alineado con lo
fact
que
that there
propone
was a previous plan in
los
place,
Estados
and
miembros
this
de la
one is
Asamblea
very
Mundial de
much
Salud
in line
para todo el
with
mundo
what
ahora. O
each
sea,
state member can
una
do.
línea que es bien concentrada en la atención
And this
primaria
line
y muy
focuses
concentrada también
heavily
en la
on
promoción,
primary care as
protección
well
y
as
apoyo a la
on
lactancia materna,
protecting and supporting
mejoramiento del entorno con respecto a la nutrición y actividad
nursing,
física, eso también
in
lo
addition
tenemos
to
alineado.
promoting
Las políticas
physical
fiscales y la
activity.
reglamentación de la publicidad, promoción
Also,
y
number
etiquetado
3
de
on the screen,
alimentos, bien como
tax
otras medidas
policies
multisectoriales, tales
and
como la que mencionó
rules
Cecilia,
on
cómo podemos no
advertisement,
solo pensar las
promotion, and
políticas
labeling of
públicas,
food.
pero cómo
And as
dirigimos esas
Cecilia was
políticas públicas para
pointing
que puedan
out, this comes with the
promover un
question of
ciclo
how can we
virtuoso de
promote a sort of virtuous
reducción de
cycle
inequidades, por
in terms
ejemplo,
of reducing
además del tema de la
inequities,
vigilancia e investigación y
in
evaluación.
addition
Y me voy
to
a concentrar en algunos
surveillance
puntos.
and
Tenemos una
research? I
herramienta
will
que ustedes
focus on a
pueden
few
acceder
points in this
en
presentation.
línea.
There
Está
are
disponible en
several
ambos
tools that you can
idiomas
access.
y
This
ahí
is
por
one of
esta
them
herramienta
online.
vamos
It's
viendo cómo los países
in
han
several languages.
implementado el plan
And
de
this
obesidad de
shows
las Américas
how
y
different
también
countries have
seguimos y que
implemented
estamos
this
trabajando junto con la
plan in the
OMS en el
Americas.
plan
And we are
global
working
para ir
together with
monitoreando y
the
siguiendo los países,
WHO
nuestros
in
9
the
países
world plan to
punta de
follow up
lanza.
on these
Pero una
9
cosa que me gustaría
pioneering
concentrar es la
countries.
importancia
One of
de
the
la
things I'd like to
regulación del
focus
ambiente
on
alimentario, de establecer ese sistema
is
regulatorio, como Luz
establishing this
mencionó,
regulatory framework
Luz, o
or
sea, tenemos que
system,
tener un paquete, tener un sistema
meaning
en
a
donde esas
system
regulaciones se aplican de manera
in which
coordinada. No
regulations
son
are applied
solamente
in
un
a
conjunto de
coordinated
medidas que están
manner. It's
puestas
not
al mismo
just a
tiempo,
number
pero
of
se
rules that
coordinan de
come
manera sistémica, ¿no?
at the same
Y
time, at the same place, but
creo
they
que
are
en
systemically
nuestra
coordinated
región
with one
hemos
another.
tenido buenos
And I think in our
avances en
region, there has
buscar
been
la
significant
regulación
progress in
de los productos que están
looking for
alimentando esta
how
epidemia de
those
obesidad
products that are
en nuestros
feeding
países,
the obesity
tanto
epidemic can be
cambiando los
regulated
patrones alimentarios como
by and
los sistemas alimentarios en
by
nuestras
changing
regiones y en todo el mundo. Y por
intake
esa razón,
patterns and other patterns that are relevant here.
nosotros una cosa que
Because
tenemos
of
hoy
this,
muy segura, basado en lo que mencionó
we know
Juan, ¿no? O
something
sea,
for
tenemos
sure.
varios desafíos, pero tenemos
There are
también
multiple
mucha claridad de
challenges
lo que se
ahead,
tiene que
but there's
hacer hoy en
also a
día. Y
lot of
una de las cosas
clarity
que
in
ya
what
sabemos
needs
muy
to be
claramente
done.
es que
One
no
of the things that
tenemos
we know that needs to be
ningún
done
chance de
is that
avanzar con
there
la
is no
prevención de
chance
obesidad si no
of making
regulamos esos
progress in
productos
all things
y
obesity unless
corporaciones
we
que están
regulate these
alimentando esta
products.
epidemia en nuestros
These
países.
products which are
Y en
feeding
nuestra
this
región,
pandemic in our
los
country.
conjuntos de
In our
políticas
region,
que hemos
the
logrado
group
avanzar, que
of
hay una
policies in which
difusión muy
we've made to
importante.
make
Para
progress
empezar, por ejemplo, con
are these
los
ones right
programas de
here.
alimentación
We can
escolar, o sea,
start by
tenemos países que
mentioning
son
the school
como
food
Brasil,
programs.
que son
Countries like
países que
Brazil,
tienen
for
una
example,
política muy amplia y
have a very
históricamente muy
broad
robusta y que eso ha
set of
podido
policies,
difundirse
very
por varias
robust,
regiones,
and that has transpired or
subregiones
traversed
de
to other
nuestra
regions or
región de las
sub-regions
Américas y
in the
prácticamente
Americas.
todos los países tienen algún programa que va
Almost every
dirigido a
country, in
mejorar
fact,
la
has a
alimentación
program
escolar.
that is
Sin
targeted
embargo, hay
for
muchos
to
elementos de
food in
mejora en cada
schools.
uno de los países, en
However,
cada una de esas
there
políticas por
are
hacer,
places for
pero
improvement
ya
in
existe
each country.
esta cultura de que eso es
But
una
there's
política
already this
necesaria y
culture
esencial
that
y nos
this
puede
is
ayudar
a
en ese
much needed
sentido
policy,
a
and that could be
enfrentar el
helpful in
problema de la
this sense
obesidad.
because we can
El otro
tackle
ejemplo
obesity
de
as a
avance
problem
que yo creo
much
que
better.
es lo
Another
más
type of progress that has been
intenso
made, and I think this is more intensive
y
in nature
rápido que hemos tenido en
and
la región es realmente
perhaps
la
faster,
adopción de los sistemas de etiquetado
is the
frontal de
adoption
advertencia.
of front
Algunos
labeling
países
in
todavía
food
están en el
products.
proceso
Some countries are still in the process of updating their regulations, such as in Ecuador and Bolivia. But overall, we see that many countries have made progress in this direction and have adopted the best evidence-based best practices to help people not only have access to this information, but also implement these policies. For instance, if we think about schools, many countries have started to, like Uruguay, they've started to look for this. Uruguay already had a policy of this nature related to schools, but as Cecilia pointed out, this regulation meant that some people at school or the carers at school had to decide, taking a look at the labels, whether that food was fit for being sold at schools. With this front labeling regulation, information is much more accessible. And so it's a lot easier to monitor what goes into schools. And it makes everything much more findable. We've also mapped out the countries that have adopted that have decided to tax sugary drinks in the Americas and in the Caribbean. As you can see here, most of the countries have not adopted this in order to make adjustments. So here, this is an area where improvement can be made. As I said, some countries have started innovating in terms of selective taxes on sugary drinks. In fact, Mexico did this a long time ago with energy drinks, for instance. Brazil tried to do this, and Colombia has done this in a very much innovative manner. But this is about regulating these products with the right type of warning and restricting these products from being so flagrantly advertised, for example. And talking about advertisement, I think this is the most challenging area, perhaps. Here we can talk about unhealthy products such as tobacco and others. This is perhaps the area in which we find the most challenges. I've brought here some examples of how we've worked with countries and how countries have made progress in their advertising policies, both in terms of restricting the advertisement of products such as Chile or Argentina, or Mexico, for instance. They're getting there too. The main challenge here is the pushback and all corporate attempts from ultra-processed foods who try to stop those policies. So countries, not only are they working in terms of promoting those policies, but also in finding ways to protect them. And this is where many challenges come up. That's the end of my presentation, and I thank you for your attention. Thank you, Fabio, for sharing this regional perspective on the efforts that are being conducted at the moment. And this also is an illustration of how important international cooperation is. And now I would like to open up the floor for our discussion. This will be moderated by our colleague, Leo Neverdeen. He's a regional advisor at PAHO. He's in nutrition and physical activity. So Leo, if that's okay, why don't we use the next 20 minutes for this section? Over to you.
Muchas gracias. Thank
you very much. We have 6 countries online who will be sharing their experience. First, I will give a brief
pequeño panel de
introduction,
los países
and then
para
we'll move
conocer
on
sus
to a
experiencias
country by
con
country
implementar
panel
estas
to learn
políticas e
about their
intervenciones
experience
para abordar la
implementing these
obesidad.
policies and
Pasamos a
interventions
la
to
siguiente
address
lámina,
obesity. Next slide, please.
por favor.
Next slide, please. Thank you.
Ok, la anterior,
The
por
previous
favor.
one. There you go.
Solo para informar, bueno,
Just for
que
context,
en nuestra región el plan de obesidad
in
de
our
la
region,
OMS ha sido
the
acogido con
WHO
mucho
obesity
interés
plan has caught a lot of
y
interest.
tenemos nada menos que 9 países
And we have
fronterizos
nine
que
nine
los hemos seleccionado un
bordering
poco
countries,
basado en
front runner
sus
countries
altas tasas
actually.
de
We've
obesidad,
selected
pero
them based
también
on their
en las
high obesity
oportunidades que
rates,
hay
yes,
para
but also
avanzar y
based
hacer
on
una
their
diferencia
possibilities
y
for
en realidad
making progress and making a
acelerar,
difference
digamos,
and
el
advancing
detener la obesidad. Entonces,
this
todos estos
process
países
of
han hecho
stopping
una
obesity. So
situación,
all of these
un
countries
análisis de la situación actual,
have undergone
han
an
mirado las
assessment of
brechas y
their current
desafíos, también
situation. They've
las barreras
analyzed
para
the
avanzar
gaps,
y
challenges,
han
and obstacles
identificado este conjunto
in
de
their own
acciones que
process of
todos son
making
ahora
progress.
parte del
They've also
paquete que fue presentado
identified, and this is
antes.
connected with the package
Han
that
hecho
was
una
presented
priorización
before.
también que es
They've
bastante importante. Han establecido
prioritized
sus
their
metas y
interventions. They've also
han
established
desarrollado
goals.
una hoja de ruta para
They've also
acelerar un
developed
plan de
a roadmap
ejecución. Están
together
trabajando
with an
también en unas
execution plan.
hojas informativas,
And
están
now they're working on
implementando
information
algunas de
leaflets.
las acciones y
They're
muy
implementing
importante
some of
también
the
están
actions, and
estableciendo
very importantly,
mecanismos de
they are
rendición
establishing
de cuentas.
mechanisms for
La
accountability.
próxima.
Next slide, please.
Acá figuran las prioridades que han
This
seleccionado esos
is
países.
a list of the
Vemos que
priorities
Argentina
selected by each
tiene
country. In the
una
case
ley
of
de
Argentina,
alimentación saludable bastante
there's a
integral,
healthy
bastante
food
completa
law that's
y su
quite
énfasis ahora
thorough,
está en el monitoreo
and the emphasis
de
here
esa
is
ley,
placed on
también la
monitoring that law,
evaluación como muy
as well
importante
as
para generar
on assessing
evidencia
it.
para los otros
This
países.
is important in order
También
to come up with
priorizan el
evidence for the
monitoreo de
rest of
la
the countries.
publicidad
Another
de los
priority here
planes
is
de la leche
monitoring
materna y
advertising,
están generando
and
evidencia para la
they are now in
implementación
the
de
process
impuestos
of creating
saludables.
evidence for
Barbados
healthy
está
taxes.
trabajando en políticas de
Barbados
alimentación en
is working
escuelas, en el
on
etiquetado de
school food
advertencia
policies
y
as well as on
impuestos también a
warning
las bebidas
labels,
azucaradas,
also
mejorar
on
el
applying
impuesto
taxes to
actual
sugary drinks,
que tienen.
in
Brasil
addition to the current
en
tax they have
políticas
in force.
regulatorias,
Brazil is working
Fabio
on
también ya
regulatory
las
policies.
mencioné,
Some of
consideramos el
these were
etiquetado
mentioned
frontal
already, such
y
as
también
front
las
labeling,
restricciones de publicidad, la regulación del
also
entorno escolar
advertising restrictions,
y también
etc.
están trabajando en
They're
la
also
seguridad
working
alimentaria
on
y nutricional,
nutritional and
abordando
food
de
safety.
manera integral todas las formas de
This means a
malnutrición a través
comprehensive
de una
approach
transformación de sistemas
of malnutrition
alimentarios.
by
A
trying
raíz
to
de este
change
plan de
the
obesidad
entire
de la OMS,
food system.
Chile ha
In the case of Chile,
lanzado una nueva estrategia nacional para
they've
detener
released
la
a new
aceleración del
national
sobrepeso
strategy
y
to stop
obesidad
the
en la niñez
acceleration
y
of overweight and
adolescencia,
obesity
con
in children and
29 líneas
adolescents.
estratégicas.
This covers 29
México
strategic
también tiene
lines.
una serie de
Mexico also
medidas,
has a series of measures in
básicamente
place.
todo el paquete. Quiero
Basically,
resaltar que
out of
también
the whole
ellos han
package, I'd like to
establecido
highlight that
mecanismos
they've
para
established
evitar los
mechanisms
conflictos de interés,
conducive
que es
to
también una
reducing
parte muy
potential
importante para
conflicts
poder
of
avanzar,
interests. And this is an important
particularmente en
step
las políticas
in
regulatorias.
advancing
La
regulatory
siguiente,
policies. Next slide, please.
la siguiente lámina, por favor.
Next slide, please.
No lo veo todavía,
I don't see it yet.
pero
Just a
puedo ir
second.
hablando.
All right, I can start
Panamá
talking anyway.
está
Panama
trabajando en el entorno alimentario
is now working
temprano,
on an
particularmente también la
early food
iniciativa de hospitales
environment
amigos del niño.
also on campaigns in hospitals. They're also working on awareness raising and education campaigns on acquisition policies and food acquisition policies in public services. They're also focusing on communication campaigns, food labeling, on promoting physical exercise in primary healthcare. Peru also has a number of strategies for healthy habits and physical activity. They're also implementing, trying to increase coverage and access to healthcare for people with overweight and obesity. And they're also focusing on early food environments. As for Trinidad and Tobago, they're also running education and awareness raising campaigns. They're focusing on policies connected with food, school nutrition, and physical education. And Uruguay is also working on preventing and addressing obesity at primary school levels, regulating the promotion and advertisement addressed to children and adolescents, also front label and other policies connected with generating evidence. I would now like to invite to the front runner countries who are here so that they can turn on the camera. And just a second, we have Argentina here, Mexico is here, Uruguay, Brazil's here, Trinidad and Tobago, Panama too. I will ask a question to each of you so that you can share a little bit of your experience. And just as a reminder, we only have 3 minutes per answer. So please make sure to respect that time allotted. So we'll look forward to your experiences and what you have to share. First question goes to Argentina. And in 2022, there was a law that came into force about healthy eating, and this has to do with front labeling. I would like to hear how Argentina is thinking about monitoring and strengthening the implementation of front labeling in foods. So we are here with our colleague Manuela Buyo from Argentina. Go ahead.
Hola Leo y hola a todos. Bueno, muchas gracias por la invitación y por la
Hello,
pregunta.
Leo. Hello, everyone. Thank you very much for the invitation and the question. Well, in Argentina, the healthy nutrition law that also includes the frontal labeling, as Leo said, in 2022. Our law has been implemented with labeling, and one of our challenges is the speaker has a problem with the monitor. Well, one of the challenges is monitoring, but also we think it is important. We are also working to strengthen other aspects of the law. The law has to do with healthy nutrition at schools. For us, it is very important to work in this aspect because this has great impact, not only in the students and professors, but also in the whole environment surrounding schools, and also working with educational content that may have an impact to generate healthy habits throughout the life of the students. And connected to what was previously said of the systemic approach of obesity, we consider it is important to work in other aspects, such as to include at all the stages the consumption of fresh foods and safe water, the joint work to promote physical activity in childhood and throughout the life, and to identify other possible intervention packages that should be appropriate for the Argentinian situation. So thank you very much for the opportunity. Thank you very much, Manuela, for sharing these experiences with us. We continue with Brazil, and we have simultaneous translation. And I would like to ask about the experience in the promotion of breastfeeding. I know that you had a great experience, so why breastfeeding develops a key role to prevent overweight and obesity in mothers and children? Which policies is Brazil implementing to promote this job?
Good
afternoon, ladies and gentlemen, and thank you very much for being here with us celebrating the Obesity Day. It is a fact, obesity is growing all over the world. Many are the causes. Of course, social, environmental aspects, and even political context, economic, social, cultural context also interfere. And this is not only about the person and their choice, what to eat, what not to eat. There are so many other variables that affect this situation. And our Ministry of Health monitors regularly everything that is happening with regards to the data, the population, overweight. There are several surveys that are robust that bring in several data with regards to our surveillance system. So what we have in the primary attention for the year 2023, 3.2 billion children that have or they are showing some change in their weight, and there are several children that have had their markers on records, and that helps us a lot with regards to how we provide care. Our impact in Brazil is actually the breastfeeding protection is part of a set of public policies. I would like to highlight which they are. As a matter of fact, we count on those policies since 1999. So we have the National Policy for Nutrition and Feeding of Children. We want to foster proper feeding, health feeding, and we also have a national policy with regards to the care to the health of children. We also have a guide for our Brazilian population, and of course there are some guidance for infants, and we have also our strategy that focus childhood, and there is a team of professionals, doctors, nurses, and several other professionals, several areas. And also we have Alimenta Brasil, which is a strategy to foster health, nutrition for health professionals, and also to improve their way of working with the communities. And there are several other nutritional pieces of information that are dedicated to that address children and adolescents. And in 2023, we have our risk screening for a primary intervention. So if we analyze from November 2023 to December 2024, that project was applied in almost 100% of our territory. So we acknowledge the fact that there is an issue with regards to food security. So a very important aspect was that in 2024, we universalized our incentives, financial incentives to so that all states count on this resource. As a matter of fact, there is this incentive according to the population and according to the social vulnerability index and also malnutrition. So those three variables are considered, and based on the results, we allocate some financial support, and that area or the municipalities would receive certain help. We also have a committee for the promotion of breastfeeding. So the main goal would be to increase breastfeeding from the golden hour to the age of 2, and
Diana Ruth, ya toca ir cerrando.
I'm
he
sorry
is
to interrupt,
asking
but we
her
need
now to
to finish.
wrap up. And she says, okay, I will. Just to finish, among all those things that I would like to highlight, is that as of the 10th of February, our World Health Organization provided a recommendation to regulate the supplement of milk for children. As a matter of fact, there was a good and important victory of all the projects developed in our Brazilian territory. As a matter of fact, everything is connected. So our main goal is that in Brazil, reach 70% of children under or infants under 6 months that are exclusively breastfed until 2030. So all those actions take us to a situation in which we understand, as a matter of fact, as our response to this world situation. And as a matter of fact, we do that with interventions from the health sector and several others. So I am more than available and I would be glad to receive your comments. Thank you very
Thank you
much.
very much. Excellent. This policies at the national level, at the leadership at an international level, promoting these solutions. Now we give the floor to Mexico. I also have a question. You have only 3 minutes, please. The question is, could you please tell us about your perspectives on the importance of advocacy for the implementation of effective policies? For example, the selective taxes to sugary beverages, the experience of Mexico in these processes. Hello, how are you? Well, it's been very important, the advocacy, as you say, in these public policy issues to implement these public policies. This is a reality in our country, such as the tax on beverages that was implemented in 2013. This was a precedent to conduct many other public policies, such as the front labeling and warning that this was introduced in 2020. Mexico, well, will enter different stages, but it's also very important the job that we have conducted with the civil societies and the strength that they had and the joint group with these alliances and all this important job with the research that was conducted at the Public Health National Institute. So this group, these alliances helped us to have these public policies in place in our country and that they are effective. Something very important were the campaigns to sensitize the population, and next we'll implement in March 29th, we'll eliminate all the ultra-processed foods from all the national schools, thanks to this advocacy. So I consider that we have done a great job in our country thanks to these alliances. It is very important because not only in advocacy we are relating this to the decision makers, but also to sensitize the population. So these are the most important tasks in the Mexican context. Advocacy proved to be an efficient mechanism and to ensure that we work for the interest of public health. So these are the most important issues that we have dealt with in Mexico in terms of advocacy, and we have reflected this with this action and these public policies, and that in Mexico, 2024, we have sustainable and healthy food law, thanks to these advocacy jobs that we could contribute with the creation of these policies.
Muchísimas gracias.
Thank you
Y en esta
very
advocacy,
much.
el papel
Advocacy
de la sociedad civil es muy
plays
importante
a
en
vital
tomar
role.
estas políticas. Seguimos inmediatamente con
So we
Panamá,
continue with Panama,
que ha lanzado recientemente un plan
who has
nacional
recently
hacia
launched the
control de
national
obesidad.
plan to
Y
prevent and eradicate
quisiera,
obesity.
Elsa
And
Arenas, que nos comente
we
un
have
poco
Elsa Arenas.
cómo
We
ha
would
sido
like
el
her to
proceso y
comment
cómo ha
how was the
priorizado
process
Panamá
like
las
and
políticas
how
y acciones
Panama
planteadas.
prioritized this.
Muchísimas gracias por la
Thank you
invitación.
very much for the
Tengo que
invitation.
decirles que desde diciembre
I should say that
del
in
2022,
December
cuando fuimos
2022,
invitados a formar parte de esta
where we were
iniciativa,
invited to be
formulamos nuestra
part of this
propuesta con la
initiative, we
participación de
formulated our
claves de
proposal with
diferentes
the
sectores gubernamentales y
participation
acompañados por la
of public
academia, la
sectors,
sociedad
accompanied
civil,
by the
todos
academia, the
comprometidos.
social,
¿Cómo
the
priorizamos este contenido?
civil
Lo primero que
society.
hicimos
And
fue
how we
identificar
prioritize this
todas las
content? Well,
acciones
first we
que en el
identified
país
all
habían
the
sido
actions
desarrolladas
that
y que
were
estuvieran
developed in the
enfocadas en
country
incentivar
and
la
that were
alimentación
connected
saludable
to
o
fostering
erradicar la obesidad.
healthy feeding
Así
or
también
physical
identificamos las posibles
activity. And we also
causas que estuvieran
identified the
asociadas
possible
a
causes
ellas,
that were connected to that.
logrando tener un
And we
gran
could
panorama de las
have a
políticas y
great
programas desarrollados
landscape of the
según
policies
su
and
nivel de
programs that
avance
were
y un
developed according
esquema
to
de
their
acción o
advanced
actualización
level
que
in
alineadas
a
con
traffic
los
light
nuevos
system
paquetes
that were aligned
técnicos
with
y
the
las
new technical
intervenciones
packages and the
específicas
specific
recomendadas
interventions
por la
recommended
OMS.
by
Para la
WHO.
priorización que hicimos,
What
primero
did we
identificamos
do
los
for this prioritization?
paquetes
First, we
técnicos en
identified the
9
technical
diferentes
packages in
colores y
9
enumeramos
colors,
cada una de las
and we numbered
intervenciones que
them, taking into
identificamos
account the
según
interventions that
el
we
el color
identified
que le
according to
correspondía
the
al
color
paquete en el que se
that
estaba
corresponded to
y
the
lo llevamos
package.
a una
And we
matriz
took
de
that
priorización
to a
por grado de impacto y
prioritization
viabilidad de
matrix to see
ejecución.
the impact and the
Este
execution
ejercicio
feasibility.
se
This
realizó a nivel
exercise was
institucional
conducted at
a
an
través de
institutional
talleres con
level
diferentes
through
actores
different
claves del
workshops
sector
with
salud.
key
Y
factors
allí se
and key
lograron
players
priorizar
of the
11
health system, and
intervenciones
we prioritized
contenidas
11
en 7
interventions
de los 9
included in
paquetes
7
técnicos.
of those 9
Como
technical
algunas de estas
packages.
intervenciones
Some of
no
these
estaban
interventions
en el
were
ámbito de
not
salud, sino más
included
allá,
at the health
tuvimos que
arena,
hacer
but
una
beyond.
segunda fase
We needed to
consultando
conduct a
a
second
través de
stage
diferentes talleres
through
con
different
actores
workshops with
gubernamentales,
different
por ejemplo,
governmental
porque
actors,
la
for
parte del
example,
sector de
different
alimentación
governmental
en
players.
entornos escolares le compete
For
al
example,
Ministerio de
the school
Educación.
feeding
Hay un
depends
pequeño
on the
grupo que
Ministry
le
of
compete al
Education.
Ministerio
There's a
de
small
Desarrollo
group that
Social,
works with the
quienes
Social
supervisan
Development
menores o
Ministry
preescolares.
that
Y en
work with
términos de actividad
kindergarten.
física le
And in terms
competía
of physical
a
activity, this had to
Deportes,
do
que es
with
otra autoridad más allá
PAN
de salud.
sports, which is another
Se fue consultando
sector
entonces
beyond health.
con
So we
la
made
academia y
consultations with the
sociedad civil
academia
por el
and the
interés
civil
del
society due to the
etiquetado
interest of the
de
labeling,
etiquetado frontal de advertencia
the frontal
nutricional
labeling
que lo habíamos dejado en manos de
that
la parte
was
civil.
that depended of the civil sector, so that they could help us identify new strategies and so that they could know each other to create alliances in order to boost and accompany not only their initiatives but also ours. Thank you very much, Leo. Thank you very much, Elsa. Your description of the process was very clear, and it is also very important to highlight the importance of this job with other sectors, because the health sector cannot solve this problem alone. Now we go with Trinidad and Tobago. We go with Mr. Abdul Amin.
3 points in the prevention of overweight and obesity, and how can these policies be scaled up at the national level? 3 minutes, please.
All right. Thank you very much for inviting me. So basically, in our context in Trinidad and Tobago, One of the things that we would have noticed from early on, as we have mentioned it here many times, is that the obesity rate in the children are rapidly increasing. And we had recognized that a little while ago. In fact, it had been quite alarming, considering children would be the future adults in a short space of time. One of the things that was decided was initially was to ban soft drinks in schools, so sugar sweetened beverages, sorry. That has been quite in partnership with the Ministry of Education. As we mentioned here many times before, we must have a collaborative approach with the different sectors and not a top-down approach. So in collaboration with the Ministry of Education, we would have achieved banning the sale of sugar sweetened beverages in school. So one of the other things that we would have noticed as well, why schools, why the education system, remember these are the formative years of children, and what we had noticed as well was that the marketing towards children is so very heavy. It's very difficult in terms of trying to do a national campaign to counteract it. So then a physical campaign would have been done, which was that banning of sugar sweetened beverages. And that is a sort of behavior change type policy, which would have necessitated some behavior change in terms of children and so on, in terms of the schools. One of the other things that would have been done on a national level would have been provision of exercise equipment to schools to facilitate not just usage or but demonstration of different types of activities and so on. So our national campaigns are what you call the TT moves, Trinidad and Tobago moves, health exercise campaigns. And these would have been integrated into those the exercise equipments and so on that would have been given. The other, we're looking at different age groups. So we had programs such as camps and so on for young children, the 5 to 11 children, which would be NCD inspector camps, and we would have chosen children who would have been interested as well as with issues with obesity and so on. And these were enrolled in camps, which would have provided them with healthy eating options and so on. And finally, the young adults, which is the teenagers, we would have had what you call TT moves, healthy eating camps and so on that would have been provided for them. So basically, through a collaborative approach with the Ministry of Education, our policies would have been aimed at healthy promotion of activity and so on in schools, as well as health promotion and healthy eating in schools as well as we would have.
Okay, okay.
Thank you very
Thank you
much.
very much. Very good advances as well in this work. So our last country present here is Uruguay. Uruguay, nuestro último país presente, y yo quiero
Uruguay is
preguntar
the last
a
country
Uruguay,
here, and I would like
¿cuál
to
es el
ask
rol de la
Uruguay,
atención
what's the
primaria en
role
salud
of
para
primary
abordar la
care in
obesidad
health
de manera
to
integral?
address
¿Y
obesity
cuáles son los
in a
planes de
comprehensive
Uruguay,
manner? And what are
particularmente para
Uruguay's
llegar a los
plans in
grupos más
particular
vulnerables?
to
Virginia.
reach out to the most vulnerable groups? Go ahead. Good morning, everyone. It's an honor to share this activity with you. The previous presentations allow me to contextualize what Uruguay is doing, actually. It's true we cannot think of obesity in a specific or a single action. We need to look at it from a multidimensional perspective and develop ways and manners to address the primary care, meaning how to diagnose, address, and treat obesity. So in this sense, we have been working with PAHO to develop a grade guideline. And we've taken specific care to select who will be participating in the technical and the thematic teams. So we've put the focus on those entities and referential figures who have experience in this topic and who will be able to support the team, not only in terms of scientific evidence, but also in terms of other factors. Our expectation is that After we focus on adults, we can work with different activities at the territorial level so that this tool can be implemented and can help any healthcare professional in their consultation. We want this to be a key element that will allow to raise awareness about the problem because not many healthcare professionals focus on this, and many times obesity is not recorded in the patient's clinical history. So this tool will enable them to have all actions be oriented to stopping obesity. This is what happens in primary care, and attempting to address and control overweight or obesity. Thank you. I hope I've answered your questions. Thank you very much. Definitely, the role of healthcare is pivotal, not only in terms of treatment, but also in terms of prevention and assessing risk. So this whole package allows that. And this is what all the countries are aiming for in this obesity pandemic context. Thank you to all 6 countries who've shared their experiences with us. Do count on us to continue supporting your efforts. And now I will give the floor to Vanessa so that she can continue with this webinar session. Thank you.
Thank you, Leo. Yes, I'd also like to extend my thanks for these examples. It really is very inspirational for us all to hear these experiences. So I really very much look forward to continuing the cooperation with each of you. And our next speaker is Lilia Pedraza from the Alianza Global para la Alimentación Saludable de Niñas, Niños y Adolescentes, Alzana. Ella nos va a hablar de Building Bridges to Stop Obesity. Así que muchísimas gracias, Lilia, por estar aquí con nosotros. Tienes los próximos
Thank you so
10
much for
minutos.
being here. You have 10
Muchas
minutes.
gracias por la invitación. Ven bien
Thank
mi
you for
pantalla.
your invitation. Can you see my
Muy
screen?
bien.
Yes.
Nuevamente, gracias por la invitación. Y
Thank
a
you
ver,
for
les
inviting me.
voy a platicar qué hace
And
Alzana, qué somos y qué
I will
estamos
tell you a little bit
intentando
of
hacer
what
para
Alzana
prevenir el
does
sobrepeso y
and
la
what do we
obesidad
do
en
to prevent
niñas, niños y adolescentes.
overweight and obesity
Alzana, la
in
Alianza
children
Global
and
para la Alimentación
adolescents.
Saludable de
Alzana,
Niñas, Niños y
in
Adolescentes,
Spanish, it's
es una
Global
iniciativa
Alliance
del
for
Instituto
Healthy Eating
Nacional de
for
Salud
Children and
Pública,
Adolescents.
que
It's an
siempre
initiative
tuvo el
by
apoyo de
the
UNICEF, de OMS y de OPS,
Public
que se formó en
Institute here,
2023 y
supported by
se formó
UNICEF,
derivado de la
WHO, and PAHO. It
preocupación,
was formed
expertos en
in
nutrición
2023,
y
and
en
it
salud
derives
de
from
todos los países de América
the
Latina por la
increasing
calidad de la
concern
alimentación
experienced
de la
by
infancia.
experts in
Y ya
nutrition and
vimos, sin
health
nuevo
by
detalle, en
the
esta población
poor
que ha
quality
ido
of
empeorando,
food
¿no?
in
Entonces, Alzana se
ALC
creó con el
countries.
objetivo de
Alzana was
proteger este
created
derecho
with
porque
the
la
goal
niñez,
to
bueno, todo el
protect
mundo lo tenemos,
the
pero las niñas
right of
tienen
children
derecho a
and
una alimentación
adolescents to
saludable.
healthy
Entonces,
food.
esta alianza que hasta el
This
momento está
alliance,
integrada por 720
which is so
personas
far
que
made up
representan
of
24 países y más de
720
199
people
organizaciones,
from
está
over
integrada por academia, por
190
sociedad civil,
organizations of
por
multiple
organismos
countries, is made
internacionales,
up of
profesionales de la
academia
salud, pero
members,
también
civil
por madres,
society,
padres,
international
familiares y la
organisms,
población
healthcare
general,
professionals,
interesada en
parents,
proteger
family
este
members,
derecho
and
de la
the
niñez a
general
una alimentación
population. All of
saludable.
them are
¿Cuál
devoted
es
to
nuestro
protecting
propósito?
the interest
Revisar,
of
generar
children's
y
rights.
difundir
Our
evidencia
purpose is to
científica sobre la
review,
mala
generate,
nutrición
and communicate scientific
en
evidence
niñas, niños y
about
adolescentes y como alguien más
malnutrition
mencionó,
in
de
children and
toda la mala
adolescents.
nutrición,
And
sí enfocado sobre peso y obesidad,
we
pero
do
sabemos que
focus
en
on
América
overweight
Latina
and
también el
obesity, but we
problema
do know
de
that in
retraso en el
Latin America,
crecimiento sigue siendo
there's
persistente y que
a
aparte
problem of
existe la doble y la triple
delayed
carga de la
growth.
enfermedad.
And there's
Entonces,
also
no
a
porque
double and
los
triple
más
burden of the
pequeños,
disease.
incluso los
So
grandes, tengan sobrepeso y obesidad no significa que no haya deficiencias presentes. También tenemos
there are
el
multiple
propósito
deficiencies
de
across all age
exhortar y
groups.
ayudar a los
Also, our
gobiernos de
purpose
América
is
Latina y el
to
Caribe a implementar recomendaciones que
push
estén
and help
basadas en
governments
evidencia
from
para
Latin
proteger
America to
este
implement
derecho.
evidence-based
¿Por
recommendations to
qué? Porque
protect
tenemos la
children's
visión de
and
tener
adolescents'
nuevas
rights.
generaciones de niños
Our vision
latinoamericanos que
is to
viven en
have
entornos alimentarios
new generations of
saludables
Latin
y que
American
este
children who
fomento
can
vidas
live in
saludables.
healthy
Por
food
lo que las
environments and who grow
recomendaciones
up
que los
by
miembros
having access
iniciales
to
de
healthy
Alzana
diets. And so
identificamos
our initial
como clave para
recommendations
lograr
at
este propósito y
Sana
cumplir con
were
esta visión
identified,
se
and
detallaron en un
we
documento que
described
se
them
llamó el
in a
Consenso de
document
Cuenca,
known
el
as
cual se
the
presentó
Cuenca
en el Congreso de la
Consensus
Sociedad
that
Latinoamericana de
was
Nutrición en
released
2023
in this
en Ecuador,
event,
en la ciudad de Cuenca.
SLAN, in
Muy
Ecuador in
brevemente, aquí les
2023.
expongo
Very
cuáles son las
briefly,
recomendaciones que
these
están
are the
determinadas en el Consenso de Cuenca.
recommendations
No me voy
stated
a
in this
detener,
Cuenca consensus. You can download them by scanning the QR. But you can see that they cover from developing and promoting food guidelines, and this is the groundwork to develop food-related policies. Also, number 3, it's about school nutrition educations in order to break away with stigmas and gender stereotypes. It's not only women's job to focus on healthy habits or healthy eating. And so this covers preparing meals, taking care of care in primary education, following breastfeeding guidelines, and trying to control the youth environment. And this affects, yes, schools, but also public spaces. Some of the regulations have been mentioned before, access to drinking water, for example. All of this is addressed from a perspective that avoids conflicts of interest, that avoids or prevents the intervention from the big industries, and also promotes monitoring and prevention in research, also from an area that's free of conflicts of interest. Alsana intends to join the efforts of other actions that are currently taking place, actions that also share this goal. And so in that sense, we focus on children and adolescents because this is the most vulnerable population. They rely entirely on what society and family communities can offer to them. We don't want to double efforts, and this is why we have been joining to all these initiatives on the screen. These are only some of the multiple allies we have. What we want to do is build a bridge that can forge alliances and that can facilitate cooperation among all these groups who are indeed aiming for the same goal, preventing and controlling overweight and obesity. We have a core group in Alsana. This is made up of experts in research and civil society members, as well as international organizations. They've participated in these successful interactions between the academia and the civil society. Just as an example, I've mentioned here emergency front labeling in the Americas. You'll see that most countries have been highlighted with a star. And there was one participation from civil society which was key to pass this regulation. We understand very well that to each his own. And so we do research, we offer advice, and it is civil society's role to put this on the map and in the public agenda. The civil society is responsible and can put this to the or push this to the political parties. So we cannot be successful in any of these proposals if we don't work together with civil society. As I said before, our roles are very clear in Alsana. We know who does what to each part of the puzzle. Our goal is to promote effective collaboration between the academia, civil society, and government by sharing and translating scientific evidence in a timely manner. Because otherwise, information is lost or misinterpreted, so evidence needs to make sense. In order to have clear, accurate information at the time that it is needed, that has actually been one of the challenges, because many times you'll have the evidence, but it cannot be published or used by the government. We've also come up with strategic stakeholder networks that will strengthen the design and implementation of policies that promote healthy eating. We've also built and strengthened advocacy skills or capacities focusing on the youth. The youth do have a voice, but we want to amplify their voice so they can exercise their right to healthy eating. And we've also attempted to provide parents and carers with the right tools and practical solutions. Those of us who are parents and who need to feed them every day need to have practical solutions in terms of food handy. I will skip a few slides, but in Alsana, we've done a lot of research and activities, and we've generated evidence on how to increase the use of reduce the use of ultra-processed food especially in young children. We've organized several events, as you can see here, in which we bring together the civil society, the academia in different countries. We've also developed policy briefs together with UNICEF and several other stakeholders. And we have this page here. I kindly invite you to check it out. This is a training center, and we offer tools for the entire population. We kindly invite you to join Alsana, get to know us a little better, and support us in this task. Thank you very much.
Muchísimas gracias, Lilia, por
Thank
esa
you,
hermosa
Lilia,
presentación y por mostrarnos
for
de
your
cómo
presentation
el impacto y la llegada
and
que
showing
tiene
us
esta
how
organización en todas las
Alsana's
Américas. Así que espero que esto
impact
también sirva como una
is
plataforma
reaching
para
all of the
fortalecer
Americas. I
esas
hope this can
cooperaciones.
serve as a
And last
platform
but
to
not least,
strengthen
of course, we
cooperations.
have Pierre Cook, who is going to provide us with the youth perspective. He's a technical advisor in the Healthy Caribbean Coalition. And Pierre, welcome and thank you for being here with us today.
Thank you very much, Vanessa. And I am happy to be a part of the conversation and honored to be here as a youth advocate. Coming from the Caribbean, I have seen firsthand how the obesity problem affects young people, and not just as a health issue, but particularly as a systemic problem that influences our opportunities, our well-being, and our futures. And the conversation this year around changing systems for healthier lives, I think perfectly reflects what we as youth advocates are pushing for. And we've been saying that obesity isn't just about individual choices. It's about the systems that shape those choices. So the food that's available within our schools, the advertising targeted at young people, and the policies by government that either support or fail us. So through my work with the Healthy Caribbean Coalition, particularly with the Healthy Caribbean Youth, and with other youth organizations like the WHO Youth Council, we've seen how young people are driving action to fix these broken systems. But the question that keeps coming up is, are the decision makers actually listening to us? The young people who've been speaking at the top of our voices, are the decision makers listening to us? I think if they did, and if we continue to have young persons as a part of the solution, it would drive significant change. I had a chance to reflect on an example of Barbados. We saw that for years, youth advocates like myself were pushing for healthier school food systems. And the conversation shifted around 2017, 2018, when youth became a bigger part of the advocacy campaign. And so the Barbados Childhood Obesity Prevention Coalition started advocating with the help of young persons, with the collaboration of young persons, for a national school nutrition policy. What we saw is that by having the advocacy within the schools being led by young people, by having young persons be a part of conversations with the government and with policymakers, our goal was a bit clearer. The government listened a bit more because they understood that to ensure that all schools provide food that supports us would be a necessary benefit, and indeed the framing around a human right for us. So after years of advocacy, after years of meeting with policymakers, when we engage young persons in a more meaningful way, we found that we were finally able to be successful in 2023 with the introduction of the Barbados National School Nutrition Policy. And it sets out standards for the schools. It sets out what foods should be available. It sets out the removal of sugar-sweetened beverages within the schools. And that wasn't the end of it, and that will never be the end of it. We now, as youth advocates and civil society organizations, have a role to continue to hold the government accountable. This was a major win for us, not just because it improved food options, but because it proves something that's important. When young people speak up and push for change, we can reshape the systems around us, but we cannot do it alone. We don't have all the solutions, but we do have the passion and the lived experience. But what I've realized as well is that this isn't just a Caribbean issue. Around the world, young people are calling for the same thing, a seat at the table in shaping policies that affect our health, particularly around obesity prevention. Now, at the last meeting we had recently, the NCD Alliance in Rwanda, there were a bunch of young persons there from across the world. And we did have some conversations around obesity prevention and what is necessary to move the needle. And you know what they said? They said, we are waiting to be engaged in a meaningful way. And that's important. Too often, young people are invited to be a part of the conversation in a very tokenistic way, but not to actually shape the policies. And that's what we need. We need young persons to be a part of the solution from the inception to the execution and even after. Now, Platforms like this and being engaged in this way with organizations like PAHO helps us to be a part of that solution. Now, in terms of what I think needs to happen next, we need to continue this regulation of unhealthy marketing of food to children. Companies across the board are pushing food to children within schools, within their education systems, within their social systems, and it's in a way that's predatory. I think we also need to continue this conversation around improving food labeling. Now, there have been many successes shared in the conversation today, but there's still so much more to go. And I do think that young persons can help to push the needle a bit more. I think we also need to look at creating more safe spaces for physical activity so that being active is accessible for all young people. And this conversation around systemic change, I hope we continue it so that we don't focus on individual choices alone, because we understand now, and I hope it's clear now, that individual choices alone is not what's going to change the issue. It's not what's going to push the needle. We need to address the systemic issues so that we have policies that protect us, so we have systems that support us, so we have governments that recognize this, and so we have organizations that continue to look out for our best interests. I think we can continue it. The fight against obesity isn't just about telling people to make better choices. It's about making sure the right choice are easy and accessible. So conversations around the cost of food and access to food and access to healthy foods, that only happens when we fix the systems around us. So I'm telling you now, I've spoken to some, and I'm sure there are many more. Young people are ready to be a part of the solution. The question is, will decision makers truly listen? Will governments, health organizations, global institutions not only invite youth to the table, but actually empower us to drive the change we need? So I'll leave you with this challenge, and you can think about it. How will you ensure that going forward in the conversation around obesity prevention, and as we deal with this, how will you ensure that young people are not just consulted, but actively engaged in shaping the obesity prevention policies? Because if we're not a part of the solution, I promise you, the problem will persist. Thank you.
Well, Pierre, what a wonderful way to finish our webinar today, and you leave us with really inspirational words here. In the interest of time, so I'm going to start closing this webinar. I know that many of you have left comments in the chat, and I can only thank you all so much for your engagement today and for your participation here. The World Obesity Day marks a huge opportunity for us to address the current opportunities and challenges. So I'd like to thank you all for participating here, especially our colleagues from the WHO who have provided a global overview of the acceleration plan to stop obesity, as well as the World Obesity Federation, the civil society colleagues, advocates, PAHO colleagues, and our representatives from the Ministries of Health and Health Authorities who have also joined the session. It's extremely important to us to have your shared commitment to as we continue working together to advance effective strategies to curb obesity. And today's discussion has reaffirmed a critical reality. Addressing obesity is not just a health issue, it's not an isolated problem, it's not a clinical issue that affects individuals in an isolated way. It requires coordinated action across multiple sectors. The UN Women's contribution today has underscored the importance of integrating a gender perspective into obesity prevention efforts. And this means ensuring that policies are designed to address these disparities. Alzana has demonstrated that regional success of cooperative efforts between civil society, academia, and health authorities can move the needle forward in our fight against the current trends that we see with obesity. And Pierre here, our youth representative, leaves us with a really encouraging challenge to include all voices when we plan for activities and strategies to reduce obesity. So there is no time to waste. We must act with urgency to accelerate progress and hold ourselves accountable for delivering tangible results. I believe that today's webinar has provided us with very valuable insights, and I very much look forward to continuing the cooperation with you all across the region. Thank you all very much for being here today, and I look forward to seeing you again next time. Thank you.